My name is Jolene Neto, and for this video I'm going to demonstrate the dressing change of a central venous line as well as the removal. For the dressing change, you don't need an order as it goes with the facility's policies and procedures, and it usually would be a standing order to change the dressing and assess the site. For the central line removal, you will need a doctor's order from the doctor. So you're first going to go into the patient's room, cleanse your hands. You're going to verify the patient against the MAR for name, date of birth, as well as checking their bracelet. You're going to want to make sure that you have your central dressing change, your 4x4 gauze, alcohol, and your biofoam dressing. For the removal of the old dressing, it's a clean technique, so you're going to want to put on gloves after you've cleaned your hands. You're going to want to open your packages. To make sure that you have them ready. You're gonna want to explain the procedure to the patient, remove the pillow from the patient's head, and you're gonna want to explain to the patient that during the procedure you'll need to have their head on the opposite side as to not breathe over the site to prevent infection, and that they need to be laying flat to prevent air from getting in and creating an air embolism. You're gonna want to verify that the patient doesn't have any allergies to iodine or shellfish. And if they do, you're going to need to use Hibiclens or whatever your facility requires to use as an alternative if they are allergic to shellfish or iodine. Once you've explained the procedure to the patient, you want to make sure that the line is clamped, that the cap is on tight. You're going to want to let the patient know that it might be uncomfortable when you're removing the Tegaderm, as it may pull at the skin, and for them to let you know at any time if they do feel discomfort. So that way you can stop and let them rest a little bit. So for this, you're gonna use the alcohol swab. You're gonna want to start to remove the Tegaderm, and you're gonna wanna remove it from all the angles using the alcohol swab as needed, as it helps not pull at the patient's skin and helps make it unstuck to the patient. It helps with the removal. So obviously this isn't the perfect condition because I have a water bottle. You want to remove the Tegaderm around the line. The line is going to be sutured in place, so in real life you just want to be careful not to pull it up completely, but it should be held in place by the sutures. You want to pull it up to where you get the biofoam with the dressing, so you can assess the biofoam for coca, the color, any odor, any signs of infection. You're going to want to assess the area of the patient's site as well. So you would throw that in the biohazard. With your 4x4, you're going to pick it up, not to touch the underneath side, and you're going to place it on top in the meantime while you get your sterile dressing change ready. If you are not going to do a sterile dressing, you wouldn't have to cover the line, as at this time you could let the patient know that you're going to remove the line. You would need a tape measure, and you would need a suture removal kit, which I don't have. So you would pull up the suture with the forceps and you would cut it with the scissors. There should be two, so you would need to do it 2 times. And you will need a gauze and another Tegaderm. And as you are getting ready to pull the line out, you would let the patient know to take a deep breath, and you would pull the line out, and you would hold the, I can't do it right now because I have it taped, but you would hold the gauze for 10 to 15 seconds, or however long it takes for the bleeding to stop. You're going to want to check and make sure the bleeding stops, and you're going to want to place a Tegaderm over that. You would want to educate the patient in case they go home not to let the dressing get wet, to follow up with their provider, You're gonna want to let them know any signs and symptoms of infection. You're gonna want them to cover it maybe with a plastic bag or something while they shower, or maybe just take a bath for those few days if they have it. And once you take out the line, you wanna get the measuring tape and you wanna measure from the tip to where the port was inserted to make sure you have the whole entire catheter, and nothing may have got left in the patient or anything like that. So we'll go back to the dressing change. So you have this on top of the dressing. You're gonna want to open the dressing change kit and fold it under. You're gonna wanna take out the latex gloves as to not contaminate anything else, and put it to the side. You wouldn't need gloves on, so you would have taken your old gloves off, washed your hands, and you're gonna wanna remove the mask and place the mask on for the procedure. And then you want to, I need to make some space here. You want to take out the sterile field, only grabbing it on the sides on a 2-inch border. You're gonna wanna place it down. So you would hold it and place it down with the shiny side down. I really don't have enough room, so I'm gonna slide it over. And then you want to put on your sterile gloves off to the side, away from it, not to contaminate the area. So you want to open it up, and you're going to put on your gloves and grab these from the inside and put on your other glove. Then once you're in the sterile field, you're gonna remove the iodine. Since I've reused this, these are my iodine packaging and my alcohol. So you're gonna place it in the field. You're gonna place your gauze. You're gonna place the ruler as you need to measure it so that way you don't contaminate it. And you're gonna wanna place the Tegaderm. So once you have that, you can throw that in the trash. Well, you would just knock it off so as to not contaminate, or you could pull it from the inside and drop it in the trash can. So you're sterile and you have all your stuff. So you're gonna want to pick this up and throw it in the trash. You're gonna want to get your alcohol and open it up, as well as your iodine. And you're gonna want to swab with the alcohol while you're assessing the area for any signs and symptoms of infection, crepitus, anything that would be abnormal. You're gonna want to cleanse around in a circular motion, throwing each one away. Cleanse around in a circular motion and cleanse around in a circular motion. And then you'll throw that away, and then you will do the iodine. So you cleanse around in a circular motion. I'm just putting this back because I don't want to make a mess. Cleanse around in a circular motion and you throw them away. Once you've done all three, you're going to let it dry. You're going to want to get your ruler and make sure your measuring tape and make sure it's in centimeters. You can fold it. You're going to want to measure the port to make sure that it's the exact same length as when the doctor put it in, to make sure that it's not being pulled out or for some reason going further in. You're gonna assess the sutures, and then you're gonna go ahead and you would have the biofoam. You'll place the biofoam on there. Unfortunately, I accidentally threw my fake one away. So you'll place the biofoam on there, and then you'll go ahead and place a new Tegaderm over the area. And you're gonna want to make sure that you put the name the name, the time and the date on the Tegaderm with the piece provided. So that way you will have it marked as to when you changed it. And you would want to document your procedure. So in the documentation, you're going to want to document that it was a sterile procedure, the look of the site once you removed it, if there was any redness, any swelling, any signs of infection. You're going to want to include a patient's set of vitals. You're going to want to include how the patient tolerated the procedure and any education that you provided the patient during the removal of the central venous line or during the change of the dressing. You want to make sure that your cap is still on tight and your port is locked, so that way there's no complications regarding the port after the dressing change. And that's my central venous line dressing change video.